This is a C. Jason podcast, and I am Sushrut Waikar from Boston University Medical Center. In patients undergoing long-term hemodialysis, the most common cause of death is cardiovascular disease. We were interested in learning more about the connection between cardiovascular disease and hemodialysis. In particular, we were interested in Endothelin-1, which is an extremely potent vasoconstrictor peptide produced by endothelial cells. Previous epidemiology studies have linked higher endothelin levels with a higher risk of death and cardiovascular disease in patients with heart failure, pulmonary hypertension, and coronary artery disease. In this study, we wanted to test whether plasma endothelin-1 levels in individuals treated with hemodialysis were associated with a greater risk of death. To study this, we measured plasma endothelin-1 concentrations in stored samples from 794 patients on maintenance hemodialysis. The median concentration of endothelin-1 was 2 picograms per milliliter, which is higher than previous reports in non-CKD populations. We found that higher plasma endothelin-1 levels were seen in individuals who were younger, who had higher blood pressure, were on dialysis for longer, and in those who had higher ultrafiltration volumes. In a multivariable model, we found that the strongest associations were with ultrafiltration volume and certain laboratory values, specifically hemoglobin, platelet count, red blood cell distribution width, and lactate dehydrogenase levels. We then followed participants over a median of 28 months. The incidence of death was higher in those with higher levels of baseline plasma endothelin-1 levels. In a model adjusting for age, clinical variables, as well as laboratory variables, we found that the association between endothelin-1 levels and death remained significant. We also found that higher plasma endothelin levels were associated with a greater risk of hospitalization. Our main findings were that plasma endothelin-1 levels were higher in hemodialysis patients and that higher levels at baseline were associated with an increased risk of death. What we can't tell from this study is why endothelin levels were higher and whether endothelin-1 levels are directly harmful to patients or simply serve as a marker for underlying disease. If endothelin-1 levels are directly harmful to patients on dialysis, it would be quite interesting to test whether drugs that block endothelin-1 receptors could have a role in treating hypertension in hemodialysis patients. I want to close by thanking all of the co-authors involved in this study and also thanking DaVita Clinical Research, which provided the samples to our research group through a competitive grant application process.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition, or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.